Yeah, so thanks for being here. We'll get started. Over here we have a third grade science fair experiment about hand washing and hand sanitizer for you to peruse. And then I also brought some sample inspection equipment that our environmental health specialists carry during a normal routine inspection or a plane review or a disease investigation. And I can go over those in more detail. And before you leave today, you will get a lovely food promoter.
So no leaving early.
No
That's
leaving
right.
early.
Sure to collect.
Unless you want to see the gross pictures. So with that, this is the Q&A that came through the survey, so we'll get started. Mindy's going to start with number 1.
And so all you wanted to know about our food safety program, but we're afraid to ask, and actually you did ask. So we've got some good questions. Very informal though, so if you want to ask additional ones, if we have time, that would be great. So the first one, and these are in no particular order, thought we'd cover the whole situation about animals in retail food establishments. The ADA does allow animals, service animals to be specific, in retail food establishments. And there's some very specific guidelines and law around the whole ADA allowance. There are 2 questions that an operator of a retail food establishment can ask a customer coming in who has an animal. They can ask whether that animal performs a required task for their disability, and they can ask whether the, now I'm blanking on the second question. If it's trained for that specific task, thank you. They cannot ask what the disability is, and then they, if it's obvious that the individual has a disability, such as a blind person with a seeing eye dog, they can't ask any of those questions. So it's only if it's not obvious. The only time that an operator can ask that a service animal leave an establishment is if the service animal is being, if it's not housebroken, if it has an accident in the establishment, or if it's out of control and the owner is not controlling that animal. Otherwise, service animals can be allowed, but it's just service animals. The law is very specific to what can be asked, and it's very tricky that you can't go beyond those 2 guidelines. There is a new law that was passed at the beginning of this year, which basically helps to enforce the fact that no one can misrepresent that their animal is a service animal if it is not. Therapy animals are not service animals. So that's something to be aware. So there's very specific guidance from ADA that people may want to access and get clarification. Service animals can be dogs and miniature horses. So yes, we do have the question about small horses, miniature horses are service animals, or can be if they're trained for that task.
That is so cool. I want to be in a place where the little Shetland pony walks in to the McDonald's. There must be a YouTube on that. That's hysterical.
And that's kind of the opposite reaction that we had recently. A caller was very upset that there was a miniature horse in a store, but it's all in your perspective.
Yeah.
All right, number 2. Do you just look at floors and bathrooms? No. We do look at floors and bathrooms, but we spend a lot more time in the kitchen and asking the operator and the staff about processes. We check temperatures, cooling process, reheating, cold temperatures, hot temperatures. We observe staff hand washing after handling products, and if somebody takes out the trash, we want to make sure they come back in and wash their hands, things like that. And one of the things we do get complaints a lot from customers are, I was just in the bathroom with a employee of this restaurant. I saw them go to the bathroom and not wash their hands when they're leaving, so. They're supposed to wash their hands in the restroom, and then when they return to the kitchen, they're supposed to wash their hands again, so. And we do try to ask operators to be mindful of that, because number one, hand washing is one of the number one ways to prevent foodborne illness, but it's also something that customers really want to see is good hygienic practices, so. Lots of observing.
Right, so is it a surprise inspection? 2 point. So we don't, for the majority of our routine inspections, we don't let the establishment know that we're coming. They're scheduled on a routine basis based on the risk of what's occurring in the establishment. So we have inspections that occur once every other year up to 3 times a year, depending on that food safety risk. So when that schedule comes around for their inspection, we will just go out and do a routine inspection and not announce that. There is a caveat to that though, where we have an additional aspect of our program where we're looking at the compliance with the regulations and food safety risks that are occurring there, and if they're really out of control, then they need to, what we try to do is work with them more in depth so that they will come back into control and really address their food safety issues. So we have what we call interventions, and we will go in on an announced basis occasionally to address a specific issue. Say they need specific food safety training on hand washing or cooling or something of that nature. Then we will want to have specific individuals at the establishment. We'll want the management staff, we'll want the other online staff. And so we'll schedule that to be sure everybody is available and has time to really focus in on that intervention.
Number 4, do you wear white gloves to inspect? No, we do not wear white gloves. But the first thing we do when we enter any retail food establishment is wash our hands. Try to lead by example, and we wash our hands many times during the inspection, so no white gloves.
Although Jessa had a great idea to bring some props, and we
Yes.
have our white gloves.
There were some magic show gloves.
All right, so next question, why do restaurants need to be inspected? Well, we kind of touched on this. Basically, we're looking at food safety risk. We want to protect the public, protect all of the residents of Jefferson County as well as visitors to the county. Because there are some significant risks with food safety, and we want to prevent foodborne illness. So that is the whole reason why we're out there and why we really pay attention to these different elements of the program.
And the regulations required.
And that is a very good point. The regulations required.
Number 6, do you taste the food? And why are places still open when they have terrible food? So, no, we do not taste the food, and we're not so much concerned about the recipes. We're more concerned about the food safety and the handling methods. Hot food's hot and cold food's cold, so taste doesn't really matter.
Correct. That's for the customers to judge, I guess, whether they want to go to a place or not. So how did the public report foodborne illness? Well, there's a variety of ways, and Jessa will bring up one of the methods. You can go to our website, and there is a online form.
Contact us.
Yep.
And then on here, you can do it one of 2 ways. You can call us on the main number and report it, or you can go online and report it. And down here's some information, so you can click on the office locations. And where did they? Should be the FE one.
It's actually under report a problem.
Where's report?
Oh, reported problem, right?
Oh, there we go.
Yeah,
Thank you,
No problem.
Tom. All right, report a public health problem, food-related illness, dead animal or bird, or a website error. So here we go. So your name, your info, the suspected restaurant name, the address, the date you consumed the meal, the time, if others were ill, number of people in your party, what was the meal you consumed and what were your symptoms, the date you started the date you became ill, and the duration, did you go to the hospital, and then this also captures information for meals and beverages and such that you ate leading up to. So we try to capture a 72-hour food history. And then submit, and then that'll come to us via email immediately, and then we try to respond very rapidly. Or you can also do it on the Jeffco website through Transcom or Jeffco. It just doesn't come to us as fast. It goes through the county first, and then they forward it over to us.
So if I ate at a restaurant, I'm not sure if that restaurant was in Jefferson County or Woodward County or any other county, can I use that to report?
No, this is only for Jefferson County. So if you do report a restaurant that's from another county, we do contact the complainant and let them know that this is in Denver County, and then give them the contact information for the county, and then we'll also ask them if they would like us to forward their information to Denver County to have Denver County reach out. So they can kind of choose which avenue they want. But say they fill this form out, and in their 72-hour food history, they list restaurants in 2 or 3 different jurisdictions, then we will ask that complainant if we can share that information and forward it on to the other counties. So but we always let them know we're sharing their information, and also give them the opportunity to reach out.
So you wanna go into more detail on that?
So what happens next after I report my illness? So if it's just one of one, so that means I went out to eat by myself for lunch and then I got sick later on. So if that's what I'm reporting, individual cases, we do investigate. However, it's not an on-site investigation unless it is a suspect case of intentional food tampering. If it's just I went and ate XYZ restaurant and I got sick, we will call the restaurant and investigate. Have you had any other illness? Have you had any employees call in sick lately? Have you had any other complaints? Have you had any recent equipment failures? Things like that, to try to determine if they have anything going on. And if they have had any other complaints, we'll gather that information, contact those folks, and go out and do an on-site investigation. If you went out to eat with a whole bunch of friends and there's 5 of you and you're all sick, then yes, we will do an on-site investigation immediately. And we try to follow up with all complainants and perform the investigation within 24 hours. Because we believe the more rapid we can get out there, the more we can prevent the illness from spread. So that's important.
All right. So what does the inspector do in the restaurant? So the inspector goes out and introduces themselves to the operator, connects with the person in charge. And really our focus, and we talked about this a little already, is the risk. So their initial assessment at the restaurant is risk-based. So they'll go in and just do a quick walkthrough, and this is after, I should say, washing their hands thoroughly so that they demonstrate good hygienic practices. And then quick walkthrough to assess what are the practices going on at that particular time. What are the highest risk processes or operations that are occurring? Are there foods going out directly from the cook line that they can capture a cook temperature on? Are there obvious signs of an ill employee that they need to handle right away? Is there bare hand contact with ready-to-eat foods that are going out the door that they need to address immediately? Those are the kinds of things that they'll assess within a good, quick minute or two. And then just sort of prioritize in their minds about what are the next items that they'll look at. Are there cooling operations going on? Are there large batches of some kinds of soups or sauces that are being cooled, and do they need to take temperatures of those to then monitor the rate of cooling? So that's what we're looking at first, are all of the really higher risk types of processes. And then from there, they would look at the other regulated items, and just go down the entire list of requirements, but focusing first on those, the riskiest behaviors that are occurring. And that certainly hygienic practices, the staff, and whether they're washing their hands properly, and not eating on the line, or drinking from incorrect drink containers on the line, that sort of thing. They really do need to look at the just the behaviors of the staff that are in the kitchen.
Number 10, what happens if a restaurant has a violation? Does the restaurant get closed? This happens very rarely. No, not often. But if you go into a restaurant and you're trying to wash your hands and there's no water to wash your hands, then that's a key indicator that something's going on. We've also had an instance when you go into a facility and there's no refrigeration to hold any of the food. So those are kind of an imminent public health hazard that would require a facility to close and call for repair immediately. So, but closing a restaurant does not happen often at all.
How often does a restaurant get inspected? And then we have routine versus surprise visit. I kind of touched on this before. We have establishments which are only inspected once every couple of years, like a convenience store that just has a soda fountain, something very minimal, up to a full-service restaurant which has all kinds of processes going on, and they've got very high risk. They're inspected up to 3 times a year, and if they're entered into our program Gaining and Sustaining, which means they really have a lot of out of control risk factors, and we want to bring them back and really get them to compliance, then we're going to be looking at them even more frequent over about a 3-month period to try to really shift that behavior. So that the frequency can vary across the board depending on the risk in the establishment. And again, most of it are unannounced inspections, but we do have those scheduled inspections for those interventions where it's appropriate to do so.
Number 12, what kind of violations are there? So on our inspection form, we have 2 different kinds, critical violations and non-critical violations. Within the critical violations that are the red ones highlighted, we have the yellow highlighted violations that are the foodborne illness risk factors. And those are the critical violations that are most likely to lead to foodborne illness. So we really try to focus on those and reducing those during inspections. Non-critical violations are those that can be corrected on site, but we're not focusing as much on those as the foodborne illness risk factor violations. And any critical violation is required to be corrected within 10 days of the inspection. And with non-criticals, it's usually 90 days or so, you know, if they need to replace a floor tile or something like that. So,
Can you give a couple of examples from each
one? Sure. Some of the foodborne illness risk factor violation will be approved source. So you can't make your own spaghetti sauce at home and jar it yourself and then bring it in to serve at your restaurant. You have to get it from an approved source. Another one would be cross-contamination, and we want to see food stored in refrigerators and on cook lines and things that are stored. So chicken's not stored directly above your lettuce. You don't want to eat a chicken salad with fresh chicken juice that's raw. So we want to prevent foodborne illness and ensure that chicken's stored on the bottom and the lettuce is stored somewhere else so as not to be contaminated. People with illness such as vomiting and diarrhea need to be restricted from work for 24 to 48 hours from their last symptom. Hand washing is another one, and hygienic practices, and preventing food from bare hand contact. So if you go to a restaurant and they're making your salad, they shouldn't be touching any of your food with their hands, because that salad isn't gonna be cooked. They have to use tongs or gloves or any kind of utensil that minimizes any kind of bare hand contact. If you're ordering a pizza, on the other hand, the pizza's gonna go through an oven, which is a kill step, so they can put everything on your pizza with their bare hands, and then once it comes out of the oven, they can't touch that pizza. Temperature controls are foodborne illness risk factors: rapidly cooling food, rapidly reheating, hot holding, required cooking temperatures. So we wanna make sure that your hamburger's cooked to 155 or your chicken's cooked to 165. If a hamburger is not cooked to 155, then they have to have a consumer advisory on the menu that, and if you wanna order a medium rare hamburger, then you're eating at your own risk. Cold hold at 41, adequate equipment to maintain temperatures. Those are all your temperature foodborne illness violations. And then hand washing, do we have enough hand sinks in the facility? Are they accessible? Do they have soap and paper towels, or do they have things stored in them and in front of them that are not your hands? The only things that should be in a hand sink would be your hands with soap and water and nothing else. And they should always have soap and paper towels available. So those are the main foodborne illness risk factor violations. Some of the non-criticals would be, if we're checking sanitizer on a cook line and it's less than 50 parts per million, and we check chlorine residual with our test strips, and there's some test strips over there, for example, that we check. Those would be some examples, or if you have a leaky sink, something like that. As long as the sink is still functioning, it's not a critical violation, but if there's just a little drip underneath it, then that's a non-critical. Dirty mop water, things like that would be non-critical violations. So.
All right, so where can I check if the restaurant I want to go to is safe? Well, right now, we have on our website, the food service establishment inspection portion of the site, and it will open up another tab here, and there is a disclaimer that you go through, and then you can search. So you can search on part of an establishment name, or street name, or zip code, or even a date range if you know of the last month or so that you wanted to search what establishments have been inspected. So any of those are available. It's best not to search on a full name, just because you might have a misspelling or minor details there that would eliminate that from coming up in your search. So if you just search on one part of a name, you'll get everything that relates to that. And then let's say you want to go to Tacos Extravaganza, and you can look at any of the either routine or follow-up inspections. The summary here shows how many critical violations they had. This doesn't distinguish between critical and the foodborne illness risk factor criticals. It's just the total. And then the total violations, which would include any non-critical violations that they had. And say you want to look at the routine, the latest one. It would detail out all of the violations, the actual text for those violations, and then whether it was corrected on site. Anything in red to the right means it was not corrected on site, and that's the reason for the follow-up that was on the previous link. And then it'll go down through the non-critical violations as well. And so you can read through that, and you can make an assessment what you think about that. We don't include anything on here that is a summary of this is a safe place to eat, or it has, and I know we have a question coming up, but it doesn't have any particular score associated with it. We'll talk about that a little bit here in a minute. We do have the public health significance, so you can click on any of these blue links and read about what does this really mean, this particular violation about washing hands. What happens if a staff in a kitchen does not wash their hands? What kind of risk is that? So you can assess using those links as well. there's a lot more you can say, but we're getting short on time, so. Let me back to the questions here. Oh, does the restaurant get scored? And you want to continue on that?
Sure.
So, at this point, we do not score any of our inspections. Years back, for a few of us in the room, remember that we used to score our inspections. Then that was taken away, and we haven't been doing that for a number of years. There is an effort underway statewide. It's a risk communication methodology that's being developed, and there's a lot of stakeholders involved across the state, including other health agencies, that are developing a communication tool to really let the public know what is the risk at this establishment. Yes, you can go to our website and view these results, but does that really distill it for you into an actual risk? Can you really assess, unless you're in the business of inspecting a restaurant, can you really assess from this whether you'd eat there? And to an extent, yes, because you can read about what kinds of things were found and make that determination. But there's no conclusion to this. So they're developing this methodology where once it's approved, any agency who chooses to can adopt it. There'll be a scoring element in that methodology and some type of assessment whether and the terminology is still to be determined, but whether the establishment passes inspection, say, or whether there's a reinspection needed, or whether they fail or are closed, kind of a assessment. So that's still all being developed, and we'll see what comes of it, and we'll also make a decision whether we adopt that. We haven't made that decision and won't until it's in place. But that's kind of the status of scoring at this point.
So what else do you inspect besides restaurants? Gas stations, yes. County fairs, yes. Seasonal events, temporary food events, farmers markets. We also inspect child care facilities in the county, body art facilities, swimming pools, food trucks, on-site wastewater, and different facilities that have air pollutants. And
No, I don't think so. We captured it.
okay. So we're gonna skip number 16 and come back to that one. I think everybody's done.
And I think you probably know the answer to 17. So yes, we're part of environmental health. Our food safety program is the largest aspect of the environmental health division, just because of the number of establishments and with all of the different retail food establishments that Jessa indicated that we inspect. We're around 2,000 establishments in total. So it's a very large program.
And number 18, how often do we actually force a restaurant to close? And we covered this earlier, but not often. I can think of, one or two in the last year, so not often at all. It's very, very rare.
Just a handful.
Yep.
Would it be temporarily or long term? How do we do closings?
Temporarily, yeah. If it's hot water issue or refrigeration or major imminent health hazard. So.
Or a sewage backup. Going back to the risk communication methodology that's being developed, that may shift a bit on how often we close establishments. Again, it will be at our discretion whether we close. We'll have to assess on site, is this really an imminent health hazard? But it may kind of shift that evaluation so that we close establishments a little more frequently, and then have a process in place for them to reopen as it's appropriate. But again, that's to be determined as we develop this process.
Awesome. Well, anybody have any other questions?
No.
That was great.
Thank you.